In this video, we'll be discussing an essential medication often encountered in nursing practice, which is calcium carbonate. This medication is commonly used but can have significant effects on the body, requiring careful nursing considerations. Let's dive into its indications, action, adverse reactions, contraindications, nursing responsibilities, and patient education. Starting with indications. First, let's discuss why we use calcium carbonate. This medication has several important indications. Important indications include treatment of hypocalcemia, prevention of osteoporosis, management of hyperphosphatemia in chronic kidney disease, and antacid for gastroesophageal reflux disease, or GERD, or dyspepsia. Treatment of hypocalcemia. Calcium carbonate is used to treat low calcium levels in conditions such as hypoparathyroidism or vitamin D deficiency. Prevention of osteoporosis. It's often prescribed to supplement calcium in individuals at risk for bone loss, particularly postmenopausal women. Management of hyperphosphatemia in chronic kidney disease. Calcium carbonate acts as a phosphate binder to reduce phosphate levels in patients with CKD. Antacid for gastroesophageal reflux disease, or GERD, or dyspepsia. It helps neutralize stomach acid to relieve heartburn and indigestion. All right, moving along, let's now learn about the action of calcium carbonate and how it works. Calcium carbonate is a calcium salt that increases calcium levels in the body by supplementing dietary calcium or binding to dietary phosphate in the gut. As an antacid, it reacts with gastric acid to produce calcium chloride, water, and carbon dioxide, thereby reducing acidity. When used as a phosphate binder in CKD, it reduces phosphate absorption by forming insoluble calcium phosphate in the gastrointestinal tract. Adverse reactions. Now, like any medication, calcium carbonate can cause side effects. Some of the adverse reactions include constipation, hypercalcemia, kidney stones, rebound hyperacidity, and flatulence and bloating. Constipation. This is a common side effect due to reduced gut motility. Hypercalcemia, which is excess calcium levels, especially with high doses or in patients with impaired renal function, can lead to symptoms like confusion, nausea, and arrhythmias. Kidney stones. Prolonged use of calcium carbonate may increase the risk of nephrolithiasis, rebound hyperacidity. If stopped abruptly after long-term use as an antacid, it may cause an increase in stomach acid production. Flatulence and bloating, due to the release of carbon dioxide during the neutralization reaction. Contraindications. Calcium carbonate is not suitable for everyone. Some contraindications include hypercalcemia, severe renal impairment, hypophosphatemia, and calcium-containing kidney stones. Let's briefly go over each contraindication now. Hypercalcemia. Avoid in patients with already high calcium levels, as it can worsen the condition. Severe renal impairment. In advanced kidney disease, calcium carbonate may lead to hypercalcemia and calcifications. Hypophosphatemia. As it binds phosphate, this medication should not be used in patients with low phosphate levels. Calcium-containing kidney stones. Avoid in patients with a history of calcium oxalate stones. Nursing considerations. Remember that as nurses, we play a critical role in ensuring the safe administration of calcium carbonate. Here are some nursing considerations. Assess baseline calcium levels. Check serum calcium, phosphate, and kidney function before starting therapy. Monitor for hypercalcemia. Watch for signs like confusion, fatigue, and arrhythmias. Evaluate bowel function. Monitor for constipation and recommend dietary adjustments or stool softeners if needed. Timing of administration. For osteoporosis or hypocalcemia, administer with meals to enhance absorption. For antacid use, administer 1 to 3 hours after meals. Drug interactions. Calcium carbonate may interfere with the absorption of other medications like tetracyclines, iron, and bisphosphonates. Separate doses by at least 2 hours. Be cautious when combining with vitamin D supplements, as it can increase calcium absorption and the risk of hypercalcemia. Patient education. Finally, let's discuss what we need to teach our patients. Education is key to ensuring compliance and preventing complications. Purpose of the medication. Explain why they're taking calcium carbonate and its benefits. Dosage and timing. Stress the importance of taking it as prescribed and avoiding overdosing. Dietary considerations. Encourage patients to maintain a balanced diet with adequate fluids to reduce the risk of constipation and kidney stones. Avoid high oxalate foods like spinach if prone to kidney stones. Recognizing side effects, teach patients to report symptoms like confusion, fatigue, or severe abdominal pain, as these may indicate hypercalcemia or kidney stones. Drug interactions. Inform patients about possible interactions with other medications and the need to separate doses. Consistency. Stress that long-term benefits, especially for bone health, require regular use and adherence. Final note before we end the video, calcium carbonate is a versatile and commonly used medication with roles in managing hypocalcemia, preventing osteoporosis, and treating acid reflux. As nurses, understanding its indications, actions, side effects, and patient education is essential for safe and effective care. Alright, well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. See you again.